Many cancer treatments are given by intravenous infusion. Because these products require special handling and can cause serious side effects, they are administered at an infusion therapy clinic where healthcare professionals can monitor patients as they undergo treatment. Once arriving in the infusion therapy clinic, the first step is for the patient to check in at the front desk. The admissions coordinators will greet the patient, enter patient data, and verify insurance eligibility. Admissions coordinators are also responsible for scheduling infusion treatment visits.
Welcome to Infusion. My name is Lauren, and I'll be your nurse today.
Following check-in, the patient will be greeted by a registered nurse and will be asked 2 patient identifiers, name and date of birth.
Let me ask you a few questions, okay? How did your treatment go? Well, good.
Vital signs, a full assessment, and medication reconciliation will be completed.
Trips this summer? Been to the beach.
If the patient had his or her labs drawn the day before, the nurse will review the results before moving forward. If the patient's labs have not been drawn, they will be drawn during the IV start port access process.
All right. A little high today. Might just be that you just got to the clinic.
Yes, good thing.
So we'll check it later. Okay, I'm going to go activate your order now, and I'll come back and start your IV. Okay?
The next step is for the nurse to review the patient's chemotherapy order and lab results.
Sure. Oh yeah, her mu and creatinine are a little elevated, aren't they?
In addition to the nurse, our nurse practitioner is also reviewing both the patient's chemotherapy order and lab results. The nurse practitioner assists in monitoring patient flow, monitoring patient side effects, communicating with physicians, answering questions, and ensuring safe care.
That your BUN and your creatinine here, they're just a little elevated today. The chemotherapy can affect your kidney function, so I just wanted to make sure you're not having any changes in your urination.
Once the nurse and nurse practitioner clear the patient for treatment, his or her chemotherapy order is activated in the electronic health record.
Hey Lauren, so I talked with her and she's not having any decreased urination or anything, so we're going to go ahead with treatment today and we'll just add a liter of fluids, okay?
All right, sounds good. I'll activate it. All right, Candy, I'm about to start your IV. Where would you like it today? Your right or your left?
Right.
Okay.
After activating the chemotherapy order, the nurse will either start the patient's IV or access his or her port for treatment.
Plus they're in the bend of the arm and kind of,
Yeah.
This time also allows for the nurse to better explain the chemotherapy regimen and its side effects. Once the chemotherapy order is activated by nursing, the pharmacy staff is notified in the electronic medical record to start their review. The pharmacy staff reviews the patient's chemotherapy order, lab results, allergy history, and medication history. Once the pharmacy staff clears the patient for treatment, the pharmacy tech begins to prepare the patient's drugs for administration. For stability reasons, many infused products are stored as powders and mixed into solution immediately before being administered. Many cytotoxic drugs are reconstituted under sterile technique under a hood. After drug preparation, the pharmacy tech places the drug or drugs in a plastic bin for the nurse to transport. The nurse administers the drugs to the patient, It is important that the patient plans to spend most of the day at the infusion center. The infusion staff can give the patient an approximate length of treatment, but there are many unexpected events. Depending on the amount of space available, family members may be able to sit with or intermittently visit patients. Volunteers are available to help the staff deliver warm blankets and provide snacks to the patients. Once the infusion treatment is complete, the nurse will remove the patient's IV or deaccess his or her port. The infusion nurse will also explain potential side effects, explain when to call his or her healthcare provider, and answer any additional questions. Infusion schedules vary depending on the specific treatment. For some treatments, patients may need to receive infusions for several days in a row. For other treatments, patients will return to the clinic once every few weeks.